Let's put our hands together as we celebrate Smartly Pro. Makofi tafadhali. Congratulations to the SmartApplications International. Let's appreciate such a fantastic brand, a trailblazer, a game changer, and you are definitely taking over the market, not only here in Kenya, not only in Africa, but also the entire region.
So the forum today is just actually to enhance our promise on delivery of healthcare automations, and also dive through the different offerings that we have that automate hospital processes, that automate the patient process, and by and large is also bridging the gap between the payer, patient, and the provider connection. So we are here today at Safari Park, and we are happy to say that we have today launched our very innovative platform where the provider and the patient now have a platform where they can be able to collaborate. For example, if a person is looking for a hospital for a specific service, using that platform, they will be able to locate the providers who have those services. They'll also be able to actually proceed and probably do an online service registration. So this is what is eliminating a lot of paperwork at the point of service, where patients take a lot of time when they are being served, and the time is taken not on treatment but on operational matters. So the system we're launching today will actually enhance that, and of course we will also be giving our commandate on managing different medical schemes. So we're still going to maintain that as our core offering, where different people who have different insurance covers will be able to go and get services across those healthcare service providers. System now will have the referral capability, where the patients will be able to get their medical record shared across different providers, so that with the authorization of the patient, they will have actually their medical record on their phone, and then the patient can be able to, if so wish, share their medical record across different hospitals. So we also been automating the e-referral process, where you have to carry your prescription physically. The same now process will be on the system, where between the patient and the provider, the e-prescription, e-referral, that process will also be fully automated. Additionally, the claiming process, where the patient provider may be previously used to deliver hard copy or claims to different payers. So that process will now be fully electronic, where they will, as soon as the patient has been seen through the smart system, authenticated of course biometrically, the claim will automatically be transmitted to different payer for processing, payment, and a feedback will be given back to the provider. So really we have enhanced the processes that enable a patient to seek services, healthcare services, when they are at a provider. Given the value that this platform is going to deliver, a lot of automations, efficiencies, of course we will have an enhanced relationship with our providers. The cost may not be that significant, but what we are saying is we are delivering value and efficiency to both the patient and the provider.
The platform completely adheres to all the particular standards on security and privacy. So we have been able to implement what you're calling word-based standards on mass security. The system is very secure in terms of logging in. Who can be able to log into the system with particular credentials, as well as who can be able to access information within the system. So in terms of security, we have been able to implement the highest standards in terms of ISO as well, being a certified, ISO certified organization. As players in the healthcare space, we definitely will align with the government regulation in terms of healthcare access and the digital superhighway as well.
Part of the product that we are presenting today is a fully fledged hospital management information system that enables a healthcare service provider to fully automate their process This hospital can operate in any level of a provider from level 1 all the way to level 6. And it is not really necessary that you are a private healthcare service provider. It works both for public healthcare service providers and private healthcare service providers. So that offering is a fully scope that can automate the processes within a healthcare service provider. This is a platform that has been developed with the patient in mind. And this is a system that has also been developed with the end user in mind. I know there are many platforms out there, but our thought process is actually to make sure that the patient, who is in the center of all this, is taken care of. So of course our system also applies a lot of advanced technologies like of course AI and data. So our developments are very well informed on the need and of course the future of where healthcare delivery is headed.